are in fact live. It's showing that we are. I just want to give everyone that actually tuned in by phone a chance to hopefully find our Facebook page and from there to be able to tune in. Facebook, a couple of minutes. 2, 1. And it looks like we have a couple of people that are on here. So we're going to go ahead and get kicked off and started. Good afternoon, everyone. Thank you so much for tuning in to our industry town hall. It is my pleasure to kick off our topic today, which is really focused on a couple of our associations that are helping in the arena of mental health, behavioral health, and a lot of other services during this time, especially of COVID, but always here in Colorado. So as many of you are aware, if this is your first time watching with us, then you're in for a treat because we have got a lot of videos that we started way back in March that are available for you to replay at any given point in time. If you've already been watching with us every day on these live streams, then you know the drill. We get started with our subject matter experts. They both will have an opportunity to visit with us. If during their conversations you have comments or questions, please drop that in the comment section of this video broadcast. Any comments or questions we will take up and display and be able to try and answer for you. If you don't have any comments or questions, but you really find the content engaging, we like flattery, so we want to hear that too. So let us know how much you're enjoying the content that you're hearing. I am Juliette Abdel, President and CEO of the Westminster Chamber of Commerce, and it is my absolute pleasure to have with me Frank, who is representing the Colorado Behavioral Health Council, and Brad, who is the president or the board president of COPA, and wears another role or wears another hat as a hospital administrator, if I'm not mistaken. And so both of them will reintroduce themselves in case I butchered it. They just want to go ahead and get us kicked off and have them start the conversation. We'll have Frank kick us off with some of some information from his lens, kind of what they've experienced during this time, how they've responded to COVID, and maybe what's ahead for their industry. And I just want to give a quick shout out. It looks like Jason Gang, who's already on here watching, and a few other people. Hello, Jason, and hi, everyone. And I'll go ahead and mute myself, and Frank, you take over.
All right, thank you, Juliette. It's my pleasure to be here this afternoon. I really appreciate the invite by you and the Westminster Chamber. As Juliette said, my name is Frank Cornelia. I'm the Deputy Director and Chief Strategy Officer for the Colorado Behavioral Healthcare Council, or CBHC as we go by. CBHC is a membership organization, a trade association that represents community behavioral health providers. In our instance, we represent 17 community mental health centers across the state. I believe Community Reach Center is a member of the Westminster Chamber. They are the community mental health center that serves Adams and Broomfield County. We represent 4 managed service organizations. So those are 4 entities that contract with the state to essentially assure a network of substance use disorder providers in their contracted region. In the Westminster area, the MSO for your area is Signal Behavioral Health Network. CBHC has a couple of other specialty providers. We represent Asian Pacific Development Center, which is a part of Aurora Mental Health Center, and Servicios de la Raza, which provides services to the Latinx community. So CBHC has been around since 1967. Our membership has changed over the years, but it has always included community providers. I know this is an industry presentation today. I wanted to talk a little bit broader on some of the mental health and wellness aspects of COVID-19, and that might help us give, later in the presentation, I'll give you a little sense of how the pandemic and the associated economic downturn is affecting our industry. But first, I want to just say that the pandemic has affected every aspect of our society in unprecedented ways. We are connecting with each other differently, exemplified by doing this virtually today. We're caring for our health and well-being in new ways, and each of us are adjusting in our own set of unique circumstances the best we can with the options and resources available to us. Well, we all know that change is uncomfortable. It's hard. Coloradans who work as mental health professionals and advocates have a unique perspective into these impacts. We know that they are both acute and long-ranging, and we know that small steps now towards building new and lasting routines will help our communities stay resilient. The COVID-19 pandemic and its impact on our economy can and already has exacerbated behavioral health consequences for many of us, our loved ones, consequences that include anxiety, depression, loneliness, sleep disturbances, increased substance use disorder, trauma. They're all likely outcomes during this stressful and uncertain time. And it's more important than ever that we are intentional about taking care of ourselves and to do what we can to check in with family, friends, and neighbors in safe and healthy ways. Self-care is essential during this unprecedented time. The American Psychological Association encourages us all to maintain a healthy perspective, to stay connected with our social networks however we can responsibly can. The CDC has several recommendations to cope with the increased stress during this time, including taking breaks from watching, reading, or listening to news stories, including social media. There are many positive things that are happening throughout the world today, and it's important to keep that in mind. That we should search out positive stories. The Good News Network is a great place to find positive news stories. We all need to be taking care of our bodies in addition to our mind. We need to take deep breaths and stretch and meditate. We need to try to eat healthy, balanced meals, exercise regularly, and get good sleep. We need to avoid excessive alcohol and drugs during this time. We need to make time to unwind, to get away from our computers, to do some other activities that you enjoy, and potentially use this time to learn a new hobby or engage in a new activity. And throughout this time, we need to continue to connect with others. Social distancing has been hard, and we need to utilize technology and other resources to safely stay connected with others. So I want to turn to sort of the ways that the COVID-19 pandemic has impacted community mental health and the provision of behavioral health services across the state and really across the country. We're hearing very similar things from our sister organizations in other states. Very quickly and swiftly, behavioral health providers have transitioned most, if not all, outpatient services to telehealth. And this, for community mental health centers in Colorado, happened nearly overnight, within 24 hours, to maintain the safety of both patients and staff. Outpatient services, including individual services and group services, transitioned to telehealth, or in some cases telephonic services, as was allowed by our state regulators and payers. What occurred shortly after this transition was that we started to hear rumors that community mental health centers and other providers were closed, and this was not the case. And so one of the things that we had to do as an industry was quickly reach out to media, use public relations efforts to communicate to the public that indeed community mental health services were available. They had changed, obviously, the mode with which they were available, but we needed to get a message out swiftly to the public that they could still access services, just not necessarily through the traditional ways that they had previously. While most of our centers transitioned outpatient and individual services to telehealth, all of them maintained their emergency and crisis behavioral health services, including co-responder services. Those are services where a clinician is paired with a police officer. It's an exciting and promising best practice in behavioral health. Those services were maintained, including, as I mentioned, urgent behavioral health care services, which Community Reach Center offers in Adams County. Residential services all were maintained during this time, and precautions were put in place again to maintain the safety of the clients and the staff. PPE, personal protective equipment, as I talk about residential services, was of utmost importance. And so it was important for our industry to advocate on behalf of behavioral health providers that they too needed personal protective equipment. Certainly, we need to take precautions in nursing homes and hospitals and other healthcare settings, but it's important to keep in mind always that mental health is healthcare, and so we joined other efforts to get providers personal protective equipment to protect both patients and staff. I'll describe a little bit about community mental health centers' response to the pandemic. Each community mental health center, again, there's 17 in the state, and they have what we call a service area or a catchment area. Each one of those centers has a designated disaster behavioral health coordinator. They liaison between our public health department. And so right now they meet weekly to engage with other public health officials to identify best practices. There's a subgroup right now to talk about how to transition somebody that might have a psychiatric illness and comorbid or co-occurring COVID-19 diagnosis into residential treatment setting. And so that group includes community behavioral health providers. It includes officials from hospitals, and we talk about how to transition individuals in and out of different settings in a safe manner. Each of those disaster coordinators are coordinating several other responses in their community. And so, for example, most community mental health centers have set up warm lines. Community Reach, their warm line, I'll just give that number real quickly. It's 303-280-6602. This warm line is allows for professionals to be available to talk, listen, lend support, and facilitate referrals to other programs that can help build coping skills and bolster resiliency. That's something that I believe nearly every community mental health center has created at the request of their public health departments or their communities. It's important to note that these warm lines are not crisis lines. So just to remind everybody that Colorado does have a statewide crisis line. That number is 1-844-493-TALK or 8255. That's 1-844-493-8255. They can also text that line. It's 38255. That line is our statewide crisis line, and people are always available in person 24 hours a day for individuals that have a behavioral health crisis. One of the other programs that Community Reach Center is doing, and that several other community mental health centers are providing as well, is what they call a COVID-19 Heroes program. This program is designed specifically to serve healthcare workers during the pandemic. Any healthcare worker who lives or works in Adams or Broomfield counties can receive up to 6 counseling sessions free of charge. After initial evaluation, counseling sessions will be provided via telehealth. So those are a few examples of the community response that community mental health centers are doing. I know one of the things that we're doing as an association is to collect all of the ways that our providers have changed their operations. And so this is one of the ways that we responded to try to combat the rumor that centers were closed. And so weekly, we send out the status report. They give us information about how their operations are fluctuating based on the various stay-at-home orders and best practices for the delivery of services. Right now, as the stay-at-home order has been lifted, we are now under safer at home, and I think most local health departments, maybe I know Denver is lifting their stay-at-home tomorrow, and I believe that's happening as well for the Tri-County area. So centers right now are working on plans to phase back in physical in-person services, and so some of those centers from across the state have already begun phased-in approaches. I know that's happening with Community Reach and other centers in the metro area as well. As I mentioned before, all emergency crisis services are continuing and have continued throughout the crisis. And I think one of the ways that I think about wrapping up, as far as the impact on our industry, is that even though we have maintained operations, transitioned to telehealth, we have seen a reduction in the number of services that community mental health centers provide. What that means for centers is a reduction in revenue. So fewer clients coming in, and this could be for various reasons, but fear and anxiety certainly could be one of them. We have seen reductions of encounters and services that are anywhere from potentially 25% to even higher. Those things affect revenue, and that's sort of a double whammy as our state economy. Essentially we are in an immediate recession. We're looking at probably $3.5 billion deficit at the state budget level. And so the reduction in revenue on top of budget cuts, as our joint budget committee convenes right now to make their cuts, as they are required to have a constitutionally to have a balanced budget. Those decisions are being made right now, and we know that services will be cut. Programs will have to be cut. They've already taken measures to walk back recommendations to increase provider rates. Any bill that was introduced in the 2020 session related to behavioral health, and really related to any topic that authorizes a new program and has new spending with it, will not likely move forward. And so those are some of the things that our industry is maintaining a close eye on. One of the things that we want to do, and I know Brad's organization and mine are in alignment, that we want to make sure that we understand that cuts need to be made, but we want to make sure that we are doing as little damage to direct care service as possible, and to try to maintain as many direct service programs as possible. So that's I think that's my summary for now. I've been it's a pleasure to represent community behavioral health providers throughout this entire crisis. What we talked about, flattening the curve at the initial outset of the pandemic. One of the things that is going to happen, as I sort of listed off all the consequences of the pandemic, both from the virus itself and in terms of the economic impact, is that we think that behavioral health is going to be the second wave, the second curve, that people will, as we lessen the social distancing, that individuals are going to be entering the behavioral health system with problems associated with social isolation and consequences of the economic downturn, including substance use disorder, which I know Brad will talk more about. But that's the second curve, and we're trying to do as much as we can right now in this moment to keep services open, keep programs going as individuals become unemployed, potentially come on Medicaid or other public systems. Our centers are doing the best they can right now to maintain their position, to be able to handle this surge that we all think is coming. So I'll pause there. I know there's much more happening at the federal level. That's another thing that our associations are engaged in. There's a lot of, potentially some stimulus money coming for behavioral health. We're doing an advocacy campaign right now across the country to get $38.5 billion for community behavioral health providers, across, as I mentioned, across the country. And the next stimulus, I believe both of our senators have signed on to a bipartisan letter in support of that. And so that's the effort right now that's happening, and potentially the next stimulus or next COVID-related healthcare legislation.
Yeah. Wow. So Frank, you just went over a lot of great information. We've had a lot of people that have kind of filtered on, and some come back on and off. So if you're just now tuning in, this is our industry town hall. We've held at least 2 already. This is our 3rd one. In conjunction really with Mental Health Awareness Month, we've partnered with COPA and Colorado Behavioral Health Council. Frank just kind of finished sharing some of what we've experienced during COVID and a few different resource lines and numbers for you to be aware of. A lot of that we've filtered into the comment section of this video. There's a couple of comments that are here, and a little bit of a shout out that I want to do to a few folks that have hopped on. So hello to Ann Hogan. It looks like you're tuned in with us, Ann, and Parker Brown, as always, great to see you. So we have from our friend John Gonzalez, and he's sharing, thank you for all the great work that you're doing on behalf of your members, so your area members, and then also for the Westminster community. So thanks, John, for kind of tuning in and finding this of value. And I know John's watching from even out of state, so that's really great that he's been able to tune in with us today. So Wayne Anderson did have a question, and his question is that it seems to him the most of what you do has not changed as a result of COVID-19. Is that correct? So I guess a good way that you can look at this question is more of, what are some of the things that you've shared that you already consistently do, and then maybe branch off into sharing here are the specific new ones that we've created as a result of COVID.
Yeah, I think it's fair to say that things haven't changed and have changed. The biggest, without a doubt, the most monumental thing that has happened is this rapid transition from in-person, outpatient and in-person outpatient services, to telehealth, essentially overnight. And so that is what allowed that to happen was the public health emergency declaration, both at the federal level and at the state level. And so a lot of regulations have been waived in this public health emergency. Most everybody in the industry and in I think both the federal and state administrations believes that the horse is out of the barn when it comes to telehealth, that we will not be able to go back to the way things were previously. Part of the reason for that, and I've heard this from one member after another, is that some clients absolutely love accessing behavioral health services remotely. And you can think about it in terms of both, if they have anxiety and difficulty leaving the house, they might want to access it that way. But you can also think about it in terms of community conditions. We have just overall, we have seen client encounters fall, but those clients that are still engaged with services actually have a lower no-show rate as a result of using telehealth. And so I would say things have changed dramatically in that sense. And so one of the conversations we're having right now is how many of these telehealth regulations need to be codified or sustained into the future, as we all think that this is not, that we're not going to go back to the way things were regarding telehealth.
I think that's a great comment that you kind of made. There's a question that's followed up from it. It looks like this is from Vanessa DeMont. Vanessa is actually a candidate for House District 29, and mental health, I know, is one topic that's incredibly important to her. So she's sharing, great topics. What suggestions do you have for parents as they go into the summer and students that were receiving school-based services no longer have access, and insurance can be a huge barrier to care?
Yeah, that's a great question. I mean, my first response to that is to contact your local community mental health center, speak with somebody there about how to manage those services in light of schools and school programming being closed. Private insurance, I mean, I don't have a great answer. It can be a huge barrier to care, and they don't often fund the full continuum of services that individuals, but supported by public funding, can access. Mm-hmm. We have a behavioral health ombudsman's office. I would refer anybody that has a complaint about their private coverage and access to care, as if it's creating a barrier, to contact the behavioral health ombudsman's office in the state.
And Frank, the private insurance is covering telehealth, both telephone and virtual as well. Right. So which is good.
Yep.
A lot of private practitioners are working full time from the privacy of their own homes now. So.
Absolutely. And I think that's a great transition. So thank you, Frank. I'll go ahead and just have you mute momentarily while we transition over to Brad. Brad is representing today as the board president for COPA. So he'll be sharing from his lens kind of what they've seen the trend has been during COVID, what some of their representation maybe has done in wake of it, and then moving forward, what looks to be the future. If you're just now hopping on and you're engaging with us, please be sure to comment any questions or comments that you have into this video so that we can address those along the way. And Brad, I'll just have you take it over.
Great. Yeah, thanks for having me. Try not to have too much feedback. So yeah, I represent the Colorado Providers Association. We are a trade group for primarily substance use disorder providers, both treatment, prevention, recovery, and some research organizations. We have about 20 members, and I work full-time at West Pines Behavioral Health. We're part of Lutheran Medical Center, which is part of SCL Health. So I'm going to speak about addiction treatment and the state of that. I also go into a bit about hospital-based care, hospital situations in general. So when it comes down to our current predicament, I think it's safe to say none of us have been in this type of situation. None of us were alive during the last pandemic in 1918. So it's incredibly abnormal. And during abnormal situations, there are normal reactions. And many of the normal reactions, one could say, could be considered psychiatric conditions: difficulty with sleep, anxiety, excessive worrying, preoccupation, nightmares, depression. The good news is I suspect everyone are having those types of feelings at various times. And once we're more out of the woods, the reality is most of them won't persist, but for some people they will. And for those people, they need to seek behavioral health care in a more professional setting. The other piece is most people recover naturally through their own resources, through their own friends, their own family, their own social supports, and they won't need behavioral health. But for those who do need behavioral health, it is out there. When it comes down to addictions, I think everyone recognizes that alcohol consumption and other drug consumption has gone up markedly. Last I heard, sales were up roughly 28% in the alcohol industry. Cannabis sales are booming. Those are two of the big growth industries, and clearly indicates that it's a problem. Now, is everyone going to go on to develop a lifelong dependence on substances subsequent to this? No, they won't. But some people will. So as Frank said, everyone rapidly moved to virtual platforms for our outpatient programs. West Pines, we have 96 beds. We're in Wheat Ridge, but we certainly get patients from all over the Denver metro area, including Westminster. And we had to reduce our capacity so we could guarantee that patients had their own rooms just for their own safety. We just started doubling up again. We are testing all people who come into our addiction programs, and we try to test those who come into our psychiatric programs as well. So precautions are pretty extreme in a hospital setting because we have the good fortune of having probably the most PPE out of anyone. We have access to the best type of disinfectants that are created. There has been remarkably, negatively, a huge decrease in the number of patients in the hospital in general. Emergency department visits have plummeted. And it's concerning because that means people are still getting sick, but they're not seeking help. So people who are having strokes, people who are having heart attacks, people who are wanting services for other types of conditions aren't coming to the hospital. And it's very concerning. The reason being, people think that hospitals will be a high rate of infection or a high rate of contamination. The reality is they're probably the cleanest place one can be. So if you feel dissuaded from seeking behavioral health care or health care in general, just know that measures are taken around the clock. It's meticulously cleaned relentlessly. So there is it's a safe place to go. Don't be discouraged. Don't be afraid of getting infected. The other situation was elective procedures were put on hold. Those have resumed just this last Monday. And I know within SEL Health, if one is seeking an elective procedure, that person has to get tested, wait 24 hours for the results. If the results are negative, they can have their procedure. If the results are positive, they have to wait until they have a negative swab. So efforts are underway to really diminish the amount of people who are infected from even seeking out elective procedures. In terms of behavioral health, as Frank said, there is going to be a surge. We have already started to see it. We get probably well over 100 phone calls a day of people wanting to come into treatment, wanting counseling, wanting to see a psychiatrist. And we have the volume of demand certainly outstrips what we can provide at this time. And especially up until recently, up until just yesterday, our capacity was cut by a third. So we have 92 beds, but we were only able to use about 60 of them. So the demand is pretty extreme. Other addiction providers don't have the luxury of being affiliated with a hospital, so they might not have as much PPE. They might not have as much cleaning supplies. They may not have the ability to test clients. So their predicament is such that they're able to treat their current clients on a residential setting, but there's a general reluctance to sometimes take new clients. I think that's loosening up a little bit. But now it's a hard time to get into treatment. There's no doubt about it. And even before the pandemic, the challenges of accessing care were pretty big to begin with, because it's a complicated system. It's hard to navigate. And this has just exacerbated it. So certainly our Office of Behavioral Health through the Department of Human Services of Colorado did get some relief money that they're applying to their crisis services that a lot of the community mental health centers provide. And there are certainly efforts underway to make sure that care is more accessible. It can be a bit daunting, and we are not immune, we being healthcare in general, from the downturns, the economic downturns. Once the dust settles, it'll be a question of which programs continue to exist, which ones there's still a demand for, and some services just won't continue to exist. Now, the good news is behavioral health care, the demand will remain high, and I think those will only be growing and expanding. When you look at behavioral health, there's a lot of different pathways that people can access them. You know, if one has Medicaid, generally the community mental health centers are the avenue. We take Medicaid at West Pines. Most hospital systems take Medicaid as well. Older adults or adults with disabilities have Medicare. That can be some of the more challenging challenging payers to get services with, but hospital systems do take those. The mental health centers take those as well. And when it comes to private insurance, it's the challenge with that is knowing one's own plan, knowing how much it's going to cost, knowing the co-pays, the deductibles. It takes a level of tenacity and chutzpah to really stick to figuring that out. And it's hard to figure out where to get care if one's depressed, has a hard time concentrating, already feels overwhelmed. Frank had mentioned the Colorado crisis line. I think that's a good point of entry. They're all trained. They know the ins and outs of the entire behavioral health system. So just simply giving a call to them is a good place to start. And thank you for putting that number up again. Calling the mental health centers, even calling any of the service providers. I mean, if one calls West Pines and we can't give them the services they need, we try our best to really point them in the right direction. And again, it depends on what the insurance is and really the level of care that one needs at any point in time. I think everyone can benefit from a good course of individual psychotherapy, counseling. Sometimes that's all people need. If a person is more progressed, if they're, have a substance use disorder, we recommend coming into the hospital to get off the substance, maybe doing residential treatment, then doing outpatient subsequent to that. When it comes to psychiatric conditions, this day and age, the vast majority of people do not need to come into a psychiatric hospital. We do have actually 3 units, 2 adults and 1 senior. And really patients who come in that are acutely psychiatrically, have acute psychiatric symptoms. They're so severely depressed they want to end their lives, or there's psychotic symptoms where they're out of touch with reality and need to be inpatient in order to be stabilized. But otherwise, the majority of the course is to do it on an outpatient. There are differing levels of care. One could come to the hospital on a partial basis, where come every day for a couple of weeks. We have intensive outpatient where you come 3 days a week for 3 hours. Then there's medication clinics, and then there's individual psychotherapy. So there's a lot to know and to educate oneself about as a consumer. And if one's getting into it for the first time, I recommend just calling your insurance and going from there, because everyone should have their insurance pay for their care. There's times where there's private practice, therapists, psychologists who don't take insurance. And then it's a matter of, is that something you want to pay out of pocket for? That's it in a nutshell. I'm happy to answer questions. I know it's a whirlwind tour of the wonderful world of behavioral health during this pandemic. So if you have any questions, please type them on out.
Yeah, I do think it's a pretty fascinating time to be having this discussion. And we've had a lot of people that have hopped on since you have taken over, Brad. Just want to say a quick hello and shout out to Linda Delano, Lynn, Eric Gardner, and our former Mayor Pro Tem, Alberto Garcia, and several other folks that are with us. If you're just now hopping on, our industry town hall is really focused around mental and behavioral health. We have 2 of our key experts that are with us, Frank, that's representing Colorado Behavioral Health Council, and Brad, that's here really wearing 3 different hats, I think, but primarily here at the Colorado Providers Association. We do have one question. I'll go ahead and pull this question out. If you guys have just hopped on and just have a question in general and want us to get to it, go ahead and comment that question. If you've been on and thought of a comment or heard some information that has just wowed you, let us know what piece of information that was. I know I've heard a couple of different things. So Wayne's back at it. His question is more related to the hospitals. I know you shared, Brad, that the hospital percentage is actually really low as far as how many people are going to the hospital and are there. So could one of the reasons for people not going to the hospitals be because of the media attention on medical professionals being overloaded. And I would tend to probably agree with this. You know, we're hearing a lot that people are going because they're very sick, and you know, these COVID patients are there, and it's a little bit discouraging for some of our older patients, right, who might be having symptoms of a heart attack or stroke or high blood pressure. They're not wanting to expose themselves to potentially other people that might be carrying COVID. Do you think that has a lot to do with it, or what, in your opinion, would be that? And this is really for either or, but I know, Brad, you touched on this.
Yeah, certainly places such as New York were hit harder than us. Mm-hmm. There was a lot of effort put into having contingencies plans, having surge plans. The state constructed a whole surge capacity facility downtown, I think, in the one of the civic centers. At our peak, Lutheran Hospital, we had 30 COVID patients, and I think we had one ventilator was unused. That was about 3 weeks ago. Since then, we've seen the numbers diminishing, which is good. We did not have the surge that New York had. I think that's safe to say, hearing from other healthcare systems. But yeah, people who work directly with patients who are indeed infected there is a level of vulnerability. All measures are taken. We have the full arsenal of PPE, including the state-of-the-art masks. Mm-hmm. So generally, healthcare providers are safe, but there are instances where healthcare providers do get infected. So why people aren't coming to the hospital, I would think, it's a both and. There's a fear of infection, and then there's just, are there people going to be there who can actually take care of me? The good news is there are the peak. I think we've hit it. It's descending. Will we have another one? I have no way of knowing. Certainly, there's been a lot of speculation that we could have another peak. We could have a series of peaks. We could have we haven't hit the peak yet. The good news is there's been a more ramp up with PPE and ventilators. We have more resources than we had even a month ago.
That's awesome. Yeah, thank you for that answer, for sure. And we've got a couple more people. Hello, Gary McCune. Great to see you hop on here, and Lauren Seymour. We have one of our counselors, John Bowles, who's just thanking you both for sharing your expertise, especially during this critical time. Thank you, John, for everything our city's doing in support of COVID and for tuning into this. Vanessa does have a question, and it looks like her question, she's back as a student going into behavioral health. Can you forecast on what area of focus might be most in demand?
So I think Frank would agree with me. Community behavioral health is probably in the most demand. Wouldn't you agree, Frank?
Yeah, I would. It's a great place to start your career. And one of the things that might, if this is enticing and if it's a need, there are some funds available both at the federal level, and we've been successful in advocating for some funding for loan repayment. So, part of the deal that you might make with the community behavioral health provider is if you've gone through a program, you go to a center to get clinical hours towards licensure. Once you get licensed, you might make an agreement to stay at a provider that is a part of a health designated shortage area, and you could potentially be eligible for a loan, to have a portion or all of your loan paid back. So that's one of the opportunities of joining community behavioral health.
Yeah, for those mental health clinicians, it's $50,000. The commitment is for 3 years, and it can be renewed. I know all this because I'm actually on the governor's appointed, one of his seats, that we review the loan applications. And one other piece of advice, you're not going to make a lot of money right out of graduate school, so try not to go to a really expensive graduate school.
I think that's for any industry, right?
Well, you go into finance and you go.
Oh, that's right. That is true.
Yeah. I mean, behavioral health entry it's just pretty low. And I sit on this reviewing loan forgiveness. I'm astounded by how high some people's debt amount is. It almost makes me want to cry when I see it. I mean, it's
right.
So do what you can. I know, I'm not going to promote one school over the other, but I know Metro is very affordable. They have a graduate program in counseling. They have a graduate program in social work. I know CSU has programs. So just it's a consideration.
So, we touched a lot about, and both of you touched on this in different ways. Frank initially touched on self-care is important whenever you're staying at home, still stay moving, what you eat and what you're interacting with in your home environment. And Brad, you kind of complemented that by sharing some stats with the rise in alcohol consumption and cannabis and some other things like that. So what advice or tips would you give somebody who might be either struggling to fill their time with activities and in trying to direct them to do something that's a little bit healthier, or for those of us that might know other people that are around us, how do you approach such a sensitive subject that people turn to?
Yeah, it's a good question. Some of it is all of us giving ourselves some allowance to just slack off and be down and grieve the many things that we're losing, right? It's okay if you spend 3 hours watching Netflix. Now, it becomes problematic if it's every day is watching Netflix, right? Sometimes people should kind of reflect back, okay, when was I in a similar situation before, and how can I look at what I did then? And, there's always setting a schedule for oneself and trying to adhere to it. But certainly we all need to be kind to ourselves. And, if we put on the COVID 10, 20, 30, it's all right.
We'll work it off.
We'll work it off, or that just will be who we are.
That's right. I just wanted to add one more plug for a website that I think our state has actually done a decent job promoting helping others during this time. And that's a huge way to take care of yourself, is to maybe take some of the attention off of your situation by helping others. And so that's helpcoloradonow.org. And that's one way that people can find volunteer opportunities to help others during this time. And that's certainly a great way to take care of yourself.
And can you just, for reference, and you went over this pretty fast, Frank, earlier, that this anticipated second curve that's more of behavioral, and you foresee this more as people are, even though they're finally getting back into society and around people and finding their normal, that there would be an increase.
Yeah, so I think it's both related to, as I mentioned, the direct sort of fear and anxiety, loneliness due to the pandemic and the social isolation, but probably I would almost say more so the economic impact of this. Our public health response it's been drastic. It's potentially been necessary to do the social distancing while we get some other measures in place. But we're looking at a situation right now where I think the latest unemployment, another 3 million filed. I think we're up to 33 million unemployed. And so what's going to happen is that there are going to be, behavioral health consequences, both mental health and, as Brad mentioned, increased substance use intake. And so, when I talk about that second surge, I think we're going to see people come on to the Medicaid program that have lost jobs, have become unemployed, and they become eligible. Our Colorado Department of Healthcare Policy and Financing, our state Medicaid office, they're starting to do some forecasting, and there's some, the actuarial scientists are putting these numbers together and can predict relatively, with some accuracy, the surge that we're going to see on the Medicaid side of things. But those are all reasons why we all think that there's a behavioral health surge coming. And as like Brad said, I think certain provider types are already seeing increased calls to warm lines, increased calls to crisis, that texting and all those things indicate that people are struggling right now for a variety of reasons. And it's one of the reasons I think we've got to be careful, and we've got to make some drastic decisions at the state budget level, but we need to protect both healthcare and the behavioral health safety net for individuals that are going to need it in the coming months and years.
Absolutely. Counselor Scully, thank you for hopping on. And we even have a couple of people that are actually outside of the country that are tuning in, so you're doing a great job. One other question for you, Frank, and then I'll wrap this up. And I know, Brad, I didn't pick on you this much, but Frank, you mentioned that there was not as much demand on telehealth and some things like that. If I'm not mistaken, that was your statement earlier. Why do you think that is, even though it's at people's fingertips, and you would think that it's easier for them to be able to access an expert as opposed to going out of their way and physically going to another location?
Yeah, so services are down. I think the biggest thing is just familiarity with using the technology to access services. So what's my entry point? How do I speak to an intake person? How do I, I think most people can sort of conceptualize from media or even personal experience what it means to go in to do an assessment and to engage an outpatient, sitting in the office with a lamp and two ferns, that type of thing. But, and Mental Health Colorado has done a good job. I saw some graphics that they put up that just give people a basic script on how to ask for telehealth services. So, so in general, I mean, it's across the board, whether it's telehealth or in-person services. Encounters, what we call encounters, which is just a person comes in for a service. Those things are down, partly due to some of the things that Brad described as people's fears or anxieties about coming in and being seen in person. But to me, I think it's just about the familiarity and as I mentioned, engagement levels with people that are engaged in telehealth are high, which tells us that once people get familiar with the platform, whatever it is, they could be using a secure Zoom for a group therapy session. They could be using telephone or a platform like this for their individual counseling. Once they get familiar with that, some of the other barriers to going in, whether it's transportation or childcare, some of those things go away, and engagement actually is high once people are familiar with the platform.
Yeah, telehealth is here to stay. We'll do a hybrid approach. We will offer people the option. You can either come in person or you can do it through telehealth. And this needed to happen. Certainly, this telehealth isn't new. It's been around 15 plus years, but embracing the technology, working out the kinks, I think it's really, COVID has hastened all of that, and it's here to stay. It'll be the new normal. I suspect some individual therapists, they may not even go back to their offices. And I actually know some who that's all they do is telepsychotherapy. So
I think you're absolutely right, Brad. It's, there are always these services and products that are out there. And when people start needing them, that's really when they actually start exploring them and using them more. And you even see that with Zoom, right? That's why they're experiencing such high demand. It's been around for a while. Linda Delano shares, thank you both. This has been a lot of great information that's been shared on here. If you end up watching this video as a replay, please give us a hashtag replay. And if you have any questions that come up whenever you're rewatching, let us know so we can try and get some expert opinion and perspective on them. We're just shy of an hour, but I did promise that we would only stick to about an hour with our two guests. So I want to thank both Frank and Brad for joining us to share about both of their associations and what they've been doing in wake of COVID, what they anticipate moving forward. and ways that people can get engaged. We referenced a lot of different crisis lines, information about our Community Reach Center, in addition to Help Colorado Now, for ways that you can help your surrounding neighbor and other people. All of those have been listed in the comments section of this broadcast. Before I end, I want to emphasize two things. One is that it is Mental Health Awareness Month, so I hope that we don't stop after having this discussion today, but it continues to carry on so that we can continue to raise awareness. And as the budgets are always a challenge and there are areas that are looking to get cut, some of those vital services continue to have the resources that they need. The second thing that I wanted to close off with is, as you all know, we do these videos almost every day, and so we'll have one more that's tomorrow to end the week at 11 a.m. Join us to hear from Jefferson County Public Schools. We'll have their board president, Susan, and Superintendent Jason Glass to visit with us on what has JPS done in wake of COVID, what they foresee for their school district, and other areas that they would like to touch on. But I do want to thank Frank and Brad. Again, we had Colorado Behavioral Health Council with us and COPA, Colorado Providers Association, to share from their perspective and their lens. I thank you both so much for spending the day with us.
You're welcome. Juliet, can I give you my phone number real fast?
Absolutely, and your website too. I wanted that.
So first, COPA's is just put in Colorado Providers Association, and West Pines is westpinesrecovery.org. Phone number is 303-467-4080. Then hit option 9 to go to our intake.
303-467. I'm sorry, what was the last?
4080.
4080. Thank you. And then option 9.
You got
and then
it.
Frank, yes, thank you. Frank, what did you have any other? I know you gave us a string of ways that people can text, call, or connect.
In our private chat, I gave you a resource page that CBHC has put together.
Yes. We will get that live on our resource page.
And that's, it's highlighted at the top of our webpage, which is www.cbhc.org.
Excellent. So we've added all of these resources in the comment section. Please do not hesitate to reach out to both of our experts on their personal platforms as well. If you've landed on our page and it's your first time, please be sure that you like and follow us so you can continue to engage during this time. Even though we're socially or physically distant, we're still connected as much as possible. So enjoy the rest of your afternoon and evening. Thank you both.
Yeah, thank you,
Juliet, and thank you, everyone.
Yeah, I really appreciate it. Happy Mental Health